Thank you for staying with us on this edition of Helping Hands. I'm Vice Mayor Linda Bartz, and I'm really excited today. I have Sydney Liebman, an old friend, Program Director of Hands, and I've got Mia Batalini. Batalini. Oh, I'm so sorry. I always worry.
No, everybody likes to put an R in our name. But that's okay. Batalini.
Well, welcome.
Thank you.
Sydney, I've had you on the show before.
Yes.
We go way back.
Yes.
We always have a good time.
Yes.
So tell me again, I know about it, but let's tell the people at home a little bit about Hands Clinic.
Absolutely, proud to do so. Hands is a free medical clinic. It is a Volunteers in Medicine affiliate. All of our doctors and dentists are volunteers. They volunteer their time to come in and help those who are our patients. And our patients are made up of qualified, low-income, uninsured adult residents of St. Lucie County. So we offer primary health care, we offer dental care, vision care, and we also offer a continuum of care for those who are diagnosed with a disease that cannot be handled at a primary care facility. We're very, very fortunate. We have about 65 outside healthcare provider partnerships, and so we're able to send our patients as far away as the Moffitt Cancer Center for treatment and as close as Lawnwood and St. Lucie Medical Center and Martin Memorial Health System. So we're very, very fortunate to have those partnerships for our patients. In St. Lucie County, there are an estimated 65,000 uninsured adults. That's a third of our adult population.
Wow. And we talked a little bit before the show that I had just seen an updated presentation on the dental side of it and how the children are being treated. And you told me the dentist had seen how many kids?
By the time the school year ends, this school year, Irvin Valson, he is a hygienist, and he goes out into the schools throughout the entire school year. By the time the school year ends, he will have seen 9,000 children. And what he does, he goes into the schools, he does dental checks. The number of children that have never seen a toothbrush, never heard the word toothbrush, would astound you. And I believe you were saying earlier that when the program first started, they thought maybe, you know, every year the number of children seen would decrease. Unfortunately, it increases every year because we have new folks moving into the area. Our school system is growing every year, and so the number of children seen increases every year. And so we provide them with toothbrushes and toothpaste and floss, and we provide them with instructions on how to care for their teeth. And it's a phenomenal program. The children are followed through 6th grade. But even if a child in 7th, 8th, 9th, and so on, even if they need assistance and their parents can't afford it, we find someone who can help them. So these 9,000 children are screened. If it looks like they've got dental decay that needs to be treated right away, then we find a dentist in the area who will see them either free or for a very low cost. It's truly a phenomenal program. Phenomenal.
Well, and it's amazing how it affects their schoolwork, their sleeping, their playing. They don't want to go to school. They don't want to smile. They're in severe pain all the time.
Yes.
I have just been amazed by that program and how it has grown.
It's estimated nationwide 51 million hours of school time is lost to dental pain. And dental issues is the #1 childhood disease. #1.
Wow.
And it's avoidable, completely 100% avoidable. So we're doing what we can.
You're doing a lot, and I, for one, appreciate what you do.
Thank you.
So you brought somebody with you who I butchered her name already.
It's all good. Mia Batalini is representing Hands this month as an ambassador. For those who don't already know, we have a program that started 1 year ago called the Jewelia Project, and it's Jewelia, and it's right out of the pages of a book called The Necklace. And in that book, there are 13 women living in California that purchased a $40,000 diamond necklace as a type of social experiment to see if 13 women could get along well enough to share this expensive necklace. That was 11 years ago. We read the book a couple years ago, and thanks to Wendy Dwyer, our friend at Hands, she turned it into this fundraising project that we now have going, and it's getting ready to go into its second year. And 12 women have shared ownership of our Jewelia, and Mia is our Miss March.
Wow. And that is some necklace. That is beautiful. And you get to wear it all month?
I get to wear it all month. I am so excited. I am thrilled. In fact, I felt so regal and royal, I had to go out and buy a tiara. I thought, I want me a tiara, so I went out and I got a tiara. But it is absolutely gorgeous. It was designed and made by Greg Childress from G. Allen Fine Jewelry on Midway. And if you haven't been to his store, oh, you don't know what you're missing. But he made this gorgeous piece of jewelry, and she feels wonderful. And when they say diamonds are a girl's best friend, they weren't kidding. Diamonds are definitely a girl's best friend.
So, do you have 13 women?
We have 12.
You have 12 women.
Sydney's our 13th. She's our mom.
So, how are they getting along after a year?
Oh, Sue Ellen said it correctly when she handed over the necklace to me at Greg's store yesterday. When you first put the necklace on, especially I'm the last of the ladies to wear it for this year, you see the faces of all the other amazing 11 ladies that wore it before you, and you have their spirit with you. They've done such phenomenal things, and it also made me nervous because I'm thinking, what in the world can I do? Because now I have to wear the necklace and commit to fundraising, and all these ladies have done an incredible job. We have become friends. It has become a very close network, and we've become a team. They're all beautiful, wonderful ladies they've done brown bag bingos, quarter auctions, little black dress cocktail parties, private dinners, just unbelievable things to raise money for the Hands Clinic. And just knowing that when you wear this gorgeous piece of jewelry, you feel very special, and you go out there and you talk to people about Hands and about what Hands can do what Hands does in our community. And it's so wonderful to know that because of your efforts, you have helped a young lady who discovered a lump on her breast. Could she put food on the table? Should she go to the doctor? Well, she chose food. Fortunately for her, somebody knew about the Hands Clinic, took her to Hands, and she was taken care of. Where else would she go? And those stories are so heartwarming, and when you know that you have joined a circle of women who can raise money to keep Hands going, you know it's for a great cause, and it's very humbling, and I'm honored to be part of the circle of ladies.
How did you get involved?
Wendy Dwyer.
Oh!
I knew Wendy before I knew Sydney. I got a call from Sydney. I met Sydney a couple of times when she was with Luminaries, because I also volunteer at the Jazz Society, the Fort Pierce Jazz and Blues Society. I'm a vocalist, and I met Wendy through that, and Wendy must have given Sydney my name, because then I got a call and Sydney said, would I like to be one of the 12 ladies? And I thought, oh my gosh, can I do this? I said, can I let you know? So I immediately called my husband, who happens to be my best friend, and I said, Jimmy, do you think I can do this? I said, all these other ladies in the community have been here longer than me. They know so many people. I'm not sure I could do this, you know? And I talked to Wendy, and this, yes, you can. Say yes. And I am so glad I did. What an experience. So if Sydney calls you and says, will you be part of the ladies of Jewelia? Say yes. Say yes.
Yay.
So this is another attempt at fundraising for Hands.
Yes.
But a very successful attempt, because as I remember in our discussion, you had talked about only doing it for a year. Mm-hmm. You had talked about maybe auctioning off the piece, and it is exquisite. And I know that Greg Childress does fabulous work. And so there appeared that there was going to be an end. But even with that, as I remember, you weren't quite sure how you were going to do it. Am I going to raffle it? Am I going to do this? So you didn't box yourself in. Good move. And now you're going on to a second year.
A second year, and he's designing earrings to go with her.
Oh.
So he has committed to 4 years, and I don't know if we will carry it on that 4. Again, I'm not going to commit one way or the other. It just all depends on what the future brings, but we're for sure in for another year. It's been a phenomenal opportunity for us to get out into the community and talk about the clinic. We've never had a shortage of patients. We've definitely never had a shortage of children to serve through our pediatric dental program, but the clinic itself has never gone out into the community and asked for financial support until this year. And so when I first came on board at the clinic, there were 273,000 people in this county that had never heard of the clinic. The other 5,000 people were folks who had been served. So it was important to get that word out as quickly as possible. How can I expect anyone to donate to a cause that they've never heard of? And even if I sit down with you today and I tell you about the clinic, that doesn't mean you're going to suddenly become a supporter. We have to find your heartstring. We have to connect it to you, and then maybe you're really going to hear the message. So it's been an incredible year. The ladies have put me in front of 33,000 new faces to talk to those folks about the clinic and introduce the clinic to them. It's an opportunity that I would not have had without this necklace project. As simple as it sounds, it's just been phenomenal.
Amazing.
And the diversity has been amazing too.
And these 12 women didn't know each other. Some of them knew of each other, but they were not friends. And now they're sisters.
Definitely, definitely. You know you have someone you can call if you need anything at all, and they're there for you.
It's very true.
They have supported each event. It's just been amazing.
Yeah.
Each event, if they didn't have something else, like one of our ladies, she would love to be here, but she took a world cruise, so she couldn't be here. But other than that, anytime you need, we've been at each and every other's events, supporting, helping, volunteering in one way or another. When my event was announced, I got an email from every one of the girls saying, "What can I do for you? Where can I help? I'll sell raffle tickets, I'll do the reception table, anything you want, let me know."
But it goes beyond the events. They truly have become a sisterhood of helping each other outside of the clinic. It's a true helping hands.
That is amazing. And the fact that you are all working together and for such a great cause. Really, Hands is doing something that nobody else is doing.
No one else.
There is no duplication of services. So, and Hands is in the old Sam's building on US 1, just to let people know. So, we talk about it. We've obviously had new people come to the community. We're not always sure that they know how to reach out and get the help that they need.
And for the first time in 5 years, we have signage.
Wonderful.
How cool.
Well, thank you so much. Thank you for bringing Hands, or Jewelia, to us.
Thank you.
It is beautiful. I'm a little jealous. No, I'm not. I'm a lot jealous. Sydney, thank you. Thank you for reminding people that Hands is out there. It is to help people, and there is so much that they do, and so many volunteer hours go into that.
Yes.
So I thank you for all you do.
Thank you.
Please stay with us. We'll be right back with more Helping Hands.